Good evening, everyone. Welcome to Rehabilitation Sciences YouTube channel. We are here with another very interesting topic, integrating acupuncture in management of frozen shoulder. And we are privileged to have Dr. Upendra Goswami sir today. He is a senior physiotherapist at PGI Chandigarh. He is having more than 23 years of experience working at in field of physiotherapy and rehabilitation. He has been graduated from very reputed institute, NIOH. You must have all known institute. It is an institute of national repute. He had graduated from NIOH in 1994, and since then he is in field of physiotherapy practice. So we welcome you, Dr. Goswami, on YouTube channel, sir. Before we go ahead with your lecture, we would like to have your consent for making your lecture live on YouTube, sir.
Yes.
Yeah, thank you, sir. Thank you so much. You may start your session, sir.
All right. Good morning. Good evening, everybody. So, should I stop share? Yeah. So, good evening, everybody. I'm Upendra Goswami. I'm feeling privileged to, share certain insight in the management of the frozen shoulder. Now, ever since I passed out from NIOH in 1994, I have, been involved in the clinical practice. First, initially, I was working. The first job was in Bombay, Rehab Center, Bombay, and after that, I worked in various places. And the one thing which I experienced during whole of my clinical practice is the difficulty which we face in the management of a frozen shoulder. So what I'm going to discuss today is something my insight, my clinical experience, and my clinical journey as far as the frozen shoulder of management of the frozen shoulder is concerned. Okay, so frozen shoulder is actually an enigma. Now, why I'm saying so, let's try to understand. Most of the time we are thinking that no, frozen shoulder is either an orthopedic condition, should be treated as an orthopedic condition or a neurological condition. So if you will appreciate, then you will see that when we did our graduation, we have always studied a frozen shoulder as a part of orthopedics. Okay, and the difficulty with in studying orthopedics is that we treat only the physical component. We forget about the neurological component and the psychosomatic component of a frozen shoulder. Okay, so what is the usual medical management which we see in the orthopedics book? What we have seen is they talk about the frozen shoulder as a condition in which your shoulder is freezing constantly, and it is divided into three stages: freezing, frozen, and thawing. I do not disagree with it, or I don't say that okay, these stages are not existing. These stages, they do exist. And how what is the management advocated by an orthopedic surgeon? So the management of frozen shoulder as advocated by orthopedic surgeon is the steroid infiltration and physiotherapy. But before the patient reaches a physiotherapist, it usually becomes very, very late, because for a long time patient keeps taking round of an orthopedic surgeon, because most of the people are not able to understand that it is not an orthopedic condition, but it is a neurological condition which has to be understood in totality. Okay, for a long time like when we were student, we were also like in our clinical practice, what we learned was how to manage a frozen shoulder case. So if you remember, uh, like when I was doing my graduation, the management was give a heating pad, and uh, we used to get the patient in the gymnasium, make the patient lie down on the bed, and give traction to the shoulder, mobilize it, stretch it out, and patient used to scream, literally scream in pain. For a long time, we kept practicing. In fact, I will talk about myself. My practice remained the same. That is, a patient is of a frozen shoulder is coming to your clinic. You give some heat therapy, give ultrasonic, and mobilize. Mobilization has been the the core of the physiotherapy management for a long time. Okay, so but it's not very easy to manage a frozen shoulder with mobilization, and then there has been certain set of exercises which remains same. Even when I did my graduation, I joined in 1990 and graduated in 1994. The management and exercises which I learned during those time is still being practiced in most of the colleges, and many of the physiotherapists, they are doing exactly the same thing what I learned nearly 25, 30 years back. We have not upgraded to a position that we are supposed to be making certain changes, and the understanding of frozen shoulder is also remaining largely the same, which is I think something which is not a right thing to do. And once you will see the syllabus of a physiotherapy, where the physiotherapists are studying orthopedics and neurology. In neurology, you will hardly find any mention of the frozen shoulder. The neurology does not deal with frozen shoulder at all, while the frozen shoulder is actually involvement of your sympathetic branch of your autonomic nervous system. Yet you will find that there is no mention of frozen shoulder in neurology. So that's why when I say enigma, I really want to point this out, that we have to understand that frozen shoulder is not an orthopedic condition, but it is a neurological condition, and it has to be dealt in a very different way. So if you will see the um, the causes or the predisposing factor, you will see that what is the predisposing factor of a frozen shoulder. A 50-year-old plus person is more susceptible to frozen shoulder. A diabetic is more susceptible to a frozen shoulder. So you'll find that we are talking about the predisposing factors and certain causes like trauma. Trauma is again considered as a cause of a predisposing factor of a frozen shoulder. One component which is largely misses psychosocial issues, and the other component which a physiotherapist must remember is the cervical component of a frozen shoulder. So in my when I started practicing for a long time, since I was telling you that I have been practicing in a similar way for a long time, till I became literally frustrated when I was not getting the results in frozen shoulder. Like when we talk about the management is supposed to be, you are supposed to be giving a predictable time frame. Like patient will definitely come and ask you, in how many days I'll be getting relieved, in how many time my shoulder range will improve. Okay, so these things, they very become very difficult as far as predicting is concerned. And I found it very difficult because patients are definitely asking, how many weeks, how much time will take to manage my pain. Okay, and I was literally at the wit's end to answer them, because I was not having an answer, because patients are coming for days altogether, and I was not able to provide them the ample relief which is needed. Nearly 10 years back, I started my career in acupuncture, and I integrated acupuncture in the management of physiotherapy. Many components, and one of the component which I've thought of discussing today is the frozen shoulder. So I thank the group for inviting me, Dr. Dharam Pandey, Dr. Harpreet Singh, and Dr. Shagun Agarwal. So Dr. Harpreet had attended one of my talk earlier, so he requested that I shared certain insight in it. So I said, yes, I should definitely share it so that you can improve your physiotherapy management to the extent that the outcome of in case of a frozen shoulder becomes better for everybody. Okay, so your psychosocial issue is very, very important, like uh, a mental stress. Whenever a patient is coming to you, make sure that you do ask about the psychosocial issues, that whether the patient is having psychological stress, whether the person is women is going menopausal stage, post-menopausal stage. These are the stages where the patient becomes depressed, psychologically, starved. So that is the time when your autonomic nervous sympathetic branch of your autonomic nervous system, they start hyperreacting, and they will cause an event in which they will be swelling around the shoulder joint, and it will become painful, and ultimately the shoulder becomes frozen over a period of time, for which already know that it happens in three stages, that is stage 1, stage 2, stage 3, which I will not be discussing much in detail. And then there is a very strong cervical component which is responsible for the frozen shoulder, which is often missed. A person having a long neck, especially your thoracic outlet syndrome, is more susceptible to a frozen shoulder. This has to be understood. And bad posture. So bad posture will automatically cause an stress over the brachial plexus, and especially since your autonomic nervous system is starting at first dorsal spine. If a person is having a round shoulder, the dorsal spine, the nerve from originating from D1, D2, they will be under the tension, and it will have an impact as far as the shoulder is concerned. So this is something which has to be understood, and a cervical component has to be ruled out whenever you are dealing with a frozen shoulder. So a patient is arriving your clinic, you ensure that the cervical component is not there. Or if the cervical component is there, then you have to manage cervical component and the frozen shoulder, the shoulder component, separately and independently. Okay, so this is one thing. The conventional physiotherapy involves, you see, heat. There is a lot of controversy, and whenever I come across students and many academics, faculty members of various colleges, they talk about heat. Okay, heat in any form is acceptable. So you will find the debate that many of the faculty will be, or the physiotherapists will be saying that uh, moist heat is better than the dry heat. Don't advocate a short wave diathermy, uh, advocate a hot pack, and pack will have a better response. Believe me, no such thing exists. Heat is heat. Heat in any form, be it a heating pad, be it a shortwave diathermy, be it a ultrasonic diathermy, and belt, any form heat is going to have good impact on the making the tissue elastic and pliable. And the other four is manual mobilization and manipulation, which has been very debatable issue. For a long time, I have been advocating mobilization and manipulation. In fact, when I was young, I was teaching the manual mobilization of the frozen shoulder or of a shoulder joint to the students. There comes a time when you understand that mobilization is having no real impact, especially the manipulation, forced stretching. They don't have much role to play in the frozen shoulder. So I stopped doing the manual mobilization at all. A very gentle active assisted and active assisted mobilization is something which I advocate, and I don't advocate the manual stretching and manipulation at all. And exercises is one thing which has to be discussed, which in last 25-30 years I have seen that patients, they come to me and they still talk about the pendulum exercises and gentle mobilization, hand exercises of the shoulder, which doesn't help them much. So yes, exercise is very important, and exercise has to be prescribed in the right form. And what exercise has to be prescribed? Like what I suggest is that don't advocate the abduction in the case of frozen shoulder or shoulder pain in the first stage at all. But what you do is you advocate active assisted shoulder flexion exercises initially, and then graduate to the rotational component. That is, again, you can add assisted assistance in the form of manual assistance for doing the internal rotation and external rotation. So there is a set of exercises which I prescribe, which is not the a part of the my lecture today, but the real topic is acupuncture. Why integrate acupuncture? See, when for a long time, I practiced, I was not getting the satisfactory result. And ultimately, 10 years back, when I started, practicing acupuncture, and I started integrating acupuncture with my, physiotherapy, I started getting dramatic results, and which I would like to discuss with you and tell you how I started it. Acupuncture was the first thing which I got the introduction long back in 1995 while working in Delhi. But somehow I was not convinced, and I was not able to integrate acupuncture in my clinical practice at that time. Much later, when I started learning about it, and then I did my PG in acupuncture, I integrated acupuncture in my clinical practice. So first thing was the frozen shoulder, and frozen shoulder managed. Before that, I use certain points which I'll be just discussing with you. You will not believe it. One sitting of acupuncture in most of the cases can relieve the symptoms of pain and sleep disturbance, as well as the range of motion, gaining the range of motion in 85 to 90% of the cases. Very few cases will not be responding, and when they are not going to respond, I'm going to discuss about that also. So let's see. There is something which I wanted to discuss: acupuncture versus dry needling. Nowadays, what you see is there's dry needling courses are offered a lot of dry needling courses are being offered by many physiotherapists nowadays as online courses and offline courses. Dry needling is, in my opinion, actually a poor cousin of acupuncture. It is nothing but a poor cousin of acupuncture, and dry needling is actually a protective way of practicing acupuncture in the Western countries. Like in America and England, they are not able to say that we are practicing acupuncture. So they invented this term called dry needling for their own safety. And naturally, acupuncturist lobby, they challenge the physiotherapist as why they are practicing acupuncture when they said we are practicing acupuncture. So they did challenge, and in the defense, American acupuncturists, and they defended by saying that they are practicing dry needling and not acupuncture. But in reality, they are practicing acupuncture only. Okay, so legal is physiotherapist legally permitted to practice acupuncture in India? There's actually a office order number by the Ministry of Government of India, Ministry of Health and Family Welfare, which gives legal permission to practice acupuncture to a physiotherapist. So if you go for the legal issue of the practice of acupuncture, then yes, physiotherapists are legally permitted to practice acupuncture. Okay, and why integrate? Integration is actually the demand of the time. You will see that each and every discipline in India and the medical science today need the crutch of the physiotherapy. In fact, Ayush Ministry has made it mandatory for your Ayurveda colleges and homeopathy colleges to have a physiotherapy clinic or a person as an instructor to deliver the lecture in physiotherapy to the your Ayurveda and homeopathy students. It was earlier there for your medical students. Now it has become a part of Ayush also. So we have to understand that we cannot stand in one side and say that we are physiotherapists, we are not going to practice anything else, because ultimately everybody will be needing actually support of the other medical science or other healing sciences. So uh, it is, I advocate that physiotherapists they adopt as if they adopt it as early as possible, it will be in their favor. I will not go for detail. There are different types of acupuncture. It's one is your traditional Chinese medicine, and then you have got Japanese superficial needling. Then there's a Tung tan balance method and auricular acupuncture, and then you have got Yamamoto new scalp acupuncture. So there are various types of acupuncture which is there. So today I will give you an idea of two basic types. One is your TCM and one is your Tung, which you will be able to integrate. Okay. Uh, See, this is a slide which I'm sharing with you. For shoulder pain, your CRPS or reflex sympathetic dystrophy, including cervical radiculopathy, what I recommend is the first point to be manipulated is your ST38. ST38 is corresponding to your the motor point of tibialis anterior. Okay, so it's corresponding to tibialis anterior. So whenever you are uh, doing the acupuncture in a case of a shoulder pain, frozen shoulder, first point to be manipulated is ST38. That is the motor point of your tibialis anterior. What you do is you make the patient sit in a high standing, high sitting position, and take point your 25 millimeter needle and pierce it perpendicularly in the point ST38. This once you have needled this point, and there is another important point as your ST36, and there is another point called as Zongping. So ST36 is at the junction of your proximal tibiofibular joint, and nearly 1 inch down you have got Zongping. So these are three very important points in the management of your shoulder. So what you have to do is, suppose you have got a patient has come to you and he has got frozen shoulder of the right side. So what you have to do is you have to expose the left lower limb, opposite side. You have to needle on the opposite side. Okay, needle the ST38 first. Once you have needled, manipulate it for nearly 5 to 10 seconds, and ask the person to hold the both the hands together and ask the person to lift the hand up, as active assisted movement. Ask the person to take as high as possible and keep repeating for nearly 2 to 3 minutes, nearly 15 to 20 times of your flexion. So in 3 minutes, 4 minutes time, or 5 minutes time, the patient will be able to do nearly 10 to 20 sittings of it. In 80% of the cases, you will get a dramatic relief in the range of motion. The range of motion of a frozen shoulder will increase in nearly 80% of the cases in first sitting itself. If it is not happening, keep practicing. There is something wrong in the choice of your point. You are not, needling the right point. Then you have to together you have to needle both the points together, ST38, ST36, or Zongpeng, either of these two. You just needle that and ask the person to actively mobilize the shoulder as much as possible. So in 80% of the cases, the movement will increase. Then once the patient has gained some amount of range, you can do whatever physiotherapy which you're doing. You can go for your shortwave death, I mean, little bit of ultrasonic. If you like to do kinesio taping or anything, you can continue with it. So this is one point which I am advocating. Then there is another point. It is a Tung point, Tung acupuncture point. The number is 22.01 Chongqi. It is at the distal end of the your first metacarpal. Okay, you can see the point. See the point. Take a 25 needle and insert it vertically and count till 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and ask the patient how's the pain. Believe me, the pain intensity in majority of the cases, majority means 95% plus patient will get a dramatic relief in the pain immediately. And within 10 seconds, the patient will say, yes, the pain is less. So this is the power of this Tung point, which I'm just sharing with you. Use it. Uh, Whenever a patient is coming to you who's in extreme pain, Tung point 22.01, insert the needle, count 10, and ask the patient how is the pain. You'll believe me, you'll get a dramatic results. Okay, and once the pain is less, naturally the movement starts becoming easier. Okay, and then there are since I told you that the cervical component will be involved in majority of the cases with your frozen shoulder. So you have got 3 points: Lingu, Dabai, and Zongbai. Okay, so these are 3 points, which is a Tung acupuncture point, which you can integrate in your management. This is the point. Okay, this is at the junction of your the base of your first and second metacarpal. Okay, second, the distal end of the second metacarpal, and it is the Zongbai. It is in between the distal end of the fourth and fifth metacarpal. Okay, these are the 3 points. It's also called as magical triangle. Okay, so what you have to do is you have to insert the needle in these 3 points on the contralateral side. आपके राइट साइड में प्रॉब्लम आ रही है, लेफ्ट साइड में करोगे, लेफ्ट साइड में प्रॉब्लम है, राइट साइड में करोगे. Okay, and along with this, insert one needle in the tendo Achilles of the opposite leg. Tendo Achilles of the opposite leg. Okay, so once you and after that, leave the needle in situ for nearly 20 minutes to half an hour, and after that you discuss how's the pain, and you will see the magic of this particular acupuncture which I'm just sharing with you. Okay, a dramatic result you are going to get. Okay, so not discuss. Okay, so thank you. So this is all about I'm going to these are the few points which I have just shared with you. We'll revise it again. The first point to stimulate is ST38 and ST36 and Zongpen on the contralateral side of the shoulder. Then you have got Tung point 22.01 Chongzi. Okay, again on the contralateral side of the shoulder. And then you have got, if in case you have got the cervical component involvement, add Lingu, Dabai, Jongbai, and one needle in the tendo Achilles of the opposite side. Okay, so this is all about the acupuncture which we are going to do, and believe me, I get miracle. I get cases where the a patient who has just entered my clinic and who the patient is in extreme pain. By the time the patient is exiting out of the clinic, the hospital, they are relieved, largely to the extent many a time you will not need more than 1 or 2 sittings. Okay, so all right. Uh, so this is share, uh, and I hope that if there is some question, I will be very happy to share.
Thank you, sir. Thank you. It was really wonderful to listen to your experiences. And sometimes what you gain through your experiences as a clinician, you don't get those things through textbooks. And I think through your journey and your experiences, you have shared exactly as a clinician of how problems arise and how they can be solved in more than one ways, which you have tried. Sir, there was just a few queries regarding this. The first of them was, when do you choose not to use acupuncture? And I mean by that, what could be the contraindications that you see when you will not use this method?
Once a patient has entered your clinic, the first thing which you are going to ask is, have you eaten your food? Have you had your meal? If a patient says that he hasn't had meal for more than 3 hours, 4 hours, don't needle, because basic vehicle attack is very common. They might faint sometimes. Okay, so always ask, or whenever you are doing the acupuncture, make sure that the patient has eaten properly.
Right.
Okay, don't needle in case of very young child or a pregnant woman. Don't do in pregnant women.
Right.
Otherwise, there's no, contraindication as far as acupuncture is concerned. You will be able to do in most of the cases. Even in cases of your cancer, you'll be able to do it. In fact, I have many time done acupuncture in case of, you know, terminal cases of, cancer for the management of the pain. Like I
Okay.
was getting one case who was in the terminal stage of cancer. So he had similar shoulder issue and a lot of pain. So I did acupuncture and I got very dramatic result, good result. So you can do. There isn't much of contraindication. The only thing is you have to be cautious that the patient has eaten his full. The patient should not be hungry. He has not the patient should not be fasting, and the patient should not be pregnant. So you make sure that don't needle a pregnant woman, don't needle a child. Otherwise, there's not much contraindication in acupuncture.
Right.
And it,
And sir, any particular reason for needling on the opposite side of the body specifically?
there is a person who is already suffering an impact on one side, and if you needle the same side, the patient becomes tend to become more painful. Like they will feel the pain more. Then there is a certain your TCM and your Tung acupuncture system. They say that the acupuncturing on the opposite side is more beneficial than the needling on the same side.
Okay.
So we are sticking with that text. Okay, that knowledge that needling on the opposite side is always better than needling on the same side. Always prefer choose to do the distal point first,
Yes.
because there are certain local points also of the frozen shoulder which I have not mentioned, I have not discussed. There is a another system which is called tan balance method, which I have not talked about, and then there is a local needling also which I have not talked. Okay, so what I have just discussed is the distal points. Okay, the
Right.
reason for discussing distal point is one very simple, because they are less painful, and a patient will be not be feeling psychologically stressed when you will be, because a patient is already in pain and you are needling the same side, so they will be psychologically stressed. So always
Mm-hmm.
prefer to do the distal end first, and later on, if you want, and if you see that there are certain muscles which are tight, which needs to be released, then do on the same side also. But that should be a later part. Like I get very good result
Okay.
in majority of the cases in few settings only. And when you are integrating acupuncture, you need not call the patient every day. Like I don't call my
Mm-hmm.
patients more than 2 to 3 days in a week. Like otherwise, if you are treating a patient of a frozen shoulder, you are supposed to be calling every day,
Right.
sometimes
Right.
months altogether. But once you integrate acupuncture, you can limit the visit from one sitting once in a week, twice in a week, maximum thrice in a week, when if the patient is is in a lot of pain, a lot of stiffness is there, then you can call
Yes.
thrice in a week also. But believe me, the result which you're going to get, like the cardinal sign, one of the cardinal sign is sleep disturbance, which will be most of the patient will tell you that there's a a big sleep disturbance, in one or two sitting, maximum three sitting, the sleep disturbance will go away. Patient will not feel the sleep disturbance. He'll be able to sleep nicely.
Right.
So this is the power actually, which which is a dramatic result which we get. The sleep disturbance is literally gone in one setting, two setting, or three settings. The range of motion, improvement in the range of motion. If a patient comes to you in the first stage, freezing stage, you'll get a very dramatic result. The range will increase within 1 to 2 settings. You will not
Right.
need months of physiotherapy and stretching and mobilization and exercises.
Right.
Only one setting or two setting will be able to give you nearly 80-90% or sometimes 100% of the range of motion, which is something the inexplicable, because this is the magical thing which I experienced when I started practicing. So now, uh, if I do a follow up of a frozen shoulder case, if the patient is coming in the first stage, I'll get very good result. I need not call my patient of the first stage, stage one, for more than one setting or two setting or three setting. That is the maximum which is needed for the patient to visit. But if the patient is in
Right.
frozen stage, second stage two, then yes, they need a longer time. But the improvement is still there, and the range increases in those cases also. Though it is not the same, because frozen is a very, very tough stage to manage. Okay,
Mhm.
so you will be getting the range, but it will be not as dramatic as the stage one or the stage three. Even the thawing, you will get a very, very dramatic result within one sitting or two sittings.
Mm.
Your range will be improved. But in stage two,
Right.
it is little difficult to manage. But you have to explain the patient that since it is frozen, it is going to take some time, but patient will be happy when you say that you need not come every day. You need to come twice in a week only. So that's
Right.
one thing which attracts most of the patients. Patients feel good that they need not come for physiotherapy every day. No patient
Right.
actually wants to come to for a treatment every day in a physiotherapy clinic. Let me assure you this.
Right. And
Any other
uh,
question?
yes, and finally, sir, there was a question like, uh, do you need certain specific qualifications to practice this, or a certificate to practice this method?
There's no need actually, but if you have a certificate or a diploma or a degree, it is always desirable. It is good, but uh, what I'm discussing is something which can be managed by everybody. Like, if suppose you don't want to needle, many of physiotherapists, they are having a problem in needling. All they have to do is they can use TENS or IFT, like the point where I place the ST38 and ST36. All you have to do is put the two electrodes on ST38 and 36 and give high intensity of TENS or
Okay.
IFT.
Okay.
Then also you will get the same result.
Okay. Okay.
You need not needle. You need not needle. Okay. So
Right. I think if the physiotherapy students are listening, then they would recollect something like acupuncture, like TENS, that we studied
yeah,
sometime.
yeah. So what you have to do is you have to just put the electrode on those 2 points and give high intensity of current. Then you will get good
Okay.
result.
Okay.
And Tung point, yes, you need to needle. Needling is not very difficult. You can do a small course, 1 day or 2 day course. You will learn how to needle it. Um right now, there's no problem in practicing. The courses are readily given by so many physiotherapists who are offering the courses. You can
Right.
go for it, but Understanding a subject is more important than just learning
Right.
the technique.
Right.
That has to be, the motto. You have to understand what you are doing, why you are doing, and what kind of result you are going to achieve. Okay, because
Right.
patients are going to have n number of questions, and you have to answer and satisfy them. If you are
Right.
not able to satisfy them, patient will not stick with you.
Right. Right. Thank you so much, sir, for sharing your, I would not say knowledge, but sharing your experience of life and profession. And we thank you for being with us today. Thank you, sir.
Thank you.